So before we get into your actual studies, it would be really great for our listeners to try to understand how studies are done. So could you sort of give a study design 101, like how do we set up a good study, and how do people know that it's a good study?
Well, I'll start with there are different types of studies that can be done, and we usually start with the studies that cost less money and take fewer resources, so we can see if we should proceed to the more time-intensive and costly studies. Mm-hmm. And so researchers will usually begin with either where I began, which was with a risk assessment, so where you take data on, in this case, the chemicals that were in the air and at what concentrations or the levels they were at in the air. And then you say to yourself, well, if someone were to be exposed to this level of a chemical, what might health effects could there be? Doesn't mean there will be, but it's kind of a prediction, right? Or looking into the future, what could they be? And so, for example, if we know benzene's a human carcinogen, and so if benzene is over a particular level, that means that the risk of cancer overall, not any cancer altogether, increases. So, and the mark we look at for that is 1 in a million. So that's one type of study design. So that design is a study that can be done to kind of set up some hypotheses or say, yes, there is an exposure here that is of concern that we'd like to follow up on. The other types of kind of hypothesis generating studies that people do a lot of are ecological studies. So that's where they say, okay, what is the incidence of cancer in this county? And what is the level of benzene in this county? And so they say, okay, so in counties with higher benzene, we're seeing higher rates of cancer. And that's an ecological study. It's done at a certain geographical level and not at the individual level. So what that kind of study cannot do is it cannot show that the exposure happened before the disease. And that's what we want to be able to do. Finally, the last kind of ecological or study design that I'll talk about is a cross-sectional study, and you just look at one point in time. So all people in June 2025, we're going to look at all the people that had cancer, and we're going to look at the benzene levels in that month, and then we're going to see if there's a correlation. Once again, that can't show that the exposure happened before the disease, so it's hypothesis generating. So those are the studies that we do to kind of see if we should go further, what we're seeing. And then we get to the more analytical epidemiological studies. And these studies are designed to show that that the exposure is occurring before the disease, or to establish temporality, as we call it. And there's two types of studies you can do for that in environmental work. That is a case control study or a cohort study. For rare diseases like cancer, particularly childhood cancers, which fortunately are rare, they're devastating, but they're rare, is you do a case control study so you can get enough statistical power in your study. So what you do there is you take, within a given area and time period, you take all the children that have cancer, particular cancer you're looking at, or adults if you're looking at adults, and then you take within that same population a certain number of people that don't have cancer, so your controls. And then you look back in their histories to see what their exposures were. And so then you compare the rates of cancer, or the rates of exposure in your controls and in your cases. And if you see higher relationships in your cases or your children with cancer than in your controls, then you assume there's an association.
Thank you. Yeah, and the control subjects are to show that there's a difference between people that didn't have the exposure and people that you can show did have the exposure. Is that correct?
No, the controls are to show that people, well, that's somewhat right, but we usually think about it a little bit differently. So the controls were, you're showing in the controls that they have a lower rate of
A lower
exposure
rate.
than the cases. So some of your controls may have been exposed, but maybe they didn't get cancer. So it's,
Okay.
it's not everyone that's exposed is going to get cancer, and it's not everyone that's not exposed isn't going to get cancer, because there's other causes of cancer. So you're just looking at the difference in rates between the two.
Okay, so the subjects did get cancer, and then the controls didn't get cancer, and then
The
you're
cases
looking at
have
the
cancer, and the controls do not
Okay.
have cancer. Correct.
Thank you. Sorry for
I might have to go back.
making me dumb it down, but just
so
want
the
to make
cases
sure
have
we
cancer,
understand.
the controls don't have cancer, and you compare the exposures between
Okay.
those two groups. And if the case have higher exposures and the controls have lower exposures, then you assume there's an association between
Okay,
the exposure and the cancer.
that makes sense.
Okay.
Yes,
Yeah.
thank you.
Okay.
And so this kind of brings us to your most recent study, where it was, forgive me if I'm wrong, but it was more rigorous than your previous study
Yes.
on leukemia. And would you like to tell us a little bit about this more recent study on childhood leukemia?
Yes, so in this more recent study, it did have a more rigorous design. We used that first study, which was to somewhat hypothesis generating. We call it a preliminary study, and we saw potential associations there. So we did the second study, and what we did is we looked at. We took all children born in Colorado between, I think it was 1992 and 2019, and we looked in those children, and we selected all the children that had been diagnosed with a childhood leukemia. And then the other children born that didn't have childhood leukemia, and we made sure didn't have another cancer, we chose our controls out of that set of children. So for every child that had leukemia, we chose, I believe it was 5 or 6 controls, and matched them to that child based on the birth date, the birth year. And I think we also matched on ethnicity, Hispanic ethnicity.
So the controls were similar to the cases.
Yes, so everyone had been born in Colorado between these years, and all of these children had been registered in Colorado's birth registry. So it was the same population from which we were drawing our cases and controls, and that's really important to do to avoid some confounding.
Right. And as I was doing my homework, I think what I understood was that for this study also, you were able to have an extremely sophisticated method of determining how intense the oil and gas activity was that they may have been exposed to. Is that correct?
That is correct. So we started our studies, our epidemiological studies, using a simple inverse distant weight. And what that is you look at all the oil and gas wells that are around a home within a certain distance, or a buffer, we call it, and you measure the distance of all those wells from the home. You take the inverse of that distance. So like if it's 1 mile, you divide it by 1, so it's 1. If it's 2 miles, you take 1 divided by 2, so it now becomes a half. And those are all summed together. So that's an inverse distance weight, and that's the simple method we used in the pilot study. For the new study, we used what we call an intensity adjusted inverse distance weight. So in addition to just looking at the distance of that well pad from the home, we looked at what was going on the well pad for every month of the relevant exposure period for that given child. And so we looked at whether the well was being drilled, or it was in completions or production. We looked at the number of wells on the well pad. We looked at the production of oil or gas from the well pad, and we made adjustments for intensity based on that. And then we also used data that's been collected more recently on emissions from oil and gas pads, like how much are the benzene emissions during different phases of oil and gas production, and adjust it for that. We also adjusted for the timing. So if it was developed, let's say in 2002, when they could still have open pits and uncontrolled flowback, then we gave it a higher rating, a higher intensity than if it was more current, when we have more of the pollution control or green completions on the wells.
So let me see if I understand this correctly.
Okay.
In the first study, you looked at how far the wells were away from people and how many wells there were that they were close to and how far they were. But in the second study, you were looking more detailed at what kind of emissions, what the phase of production was, so that you knew how much benzene they were probably being exposed to.
So this well was likely to have this more benzene than this well. And also we also looked at what phase they were in Colorado regulations. So were green completions becoming standard practice, or was it before green completions were becoming practice, for example, common practice?
So that is super detailed and just capturing all the possible variables. And the conclusions were that the cases who did have childhood leukemia were more likely to live near oil and gas activity. Is that correct?
Yes, they were more likely not only to live near oil, but to live near the most intense oil and gas activity.